Thank you. Thank you, Barry. We're going to switch gears a little bit to another issue that's toxic to patient access, and that's the issue of drug shortages and supply. You can see we have a multifaceted problem here. And before I kick it off, Dr. Gould actually teed up a number of points that definitely relate to this, because it may not be clear to everyone kind of how products are supplied. But we supply about 90% of all products in the United States are going through a wholesaler or one of the distributors. And that's because you need an efficient way not to buy any of these oncology drugs by the truckload, but to buy them by that individual patient vial. And so that's a cornerstone of really the efficiency that exists in the marketplace today to reduce costs, reduce inventory, secure the supply chain, and those are all purchased directly from manufacturers. So it's a hidden piece. Our company ends up being one of the hidden pieces. Us specifically are about 50% of all oncology drugs in the United States. So we're the largest in both hospitals as well as physician clinics. And we also are the largest in brand as well as generic. So kind of seeing all sides of both the cost paradigm as well as the supply issues that go along with that. So it's a broad perspective at which we kind of come at this drug supply issue. And at the end of the day, if we don't have the product, we're not in business for long, and we know that patients aren't getting the care that they need. So a common question I'm asked is related to this drug shortage issue. You see it go in the press, and then it gets replaced by other issues. Are we making a difference? Is anything happening? Is the problem getting worse? Has it gotten better? It's hard to tell, to be honest with you, whether or not things have improved. If I had to sum it up in one sentence, I would tell you that we are seeing supply issues each and every day. Those supply issues tend to be, and this is that first paradox, tend to be correlated to the lowest cost products. So that's where we've had the most urgent supply issue, and Barry teed up this concept of paradox, and that's exactly what we have when we think about these shortage issues. There's some data out there. In fact, the best study, I think, was this New England Journal of Medicine study published just in December, which really showed vast majority of oncologists, 82% of oncologists, had in fact experienced these types of supply issues related to chemotherapy products themselves at least once in the past 6 months, although you can see from the data, it appears that this is a daily reality for most clinicians, and they have to respond, and how they respond, which is shown on the table on the right, varies pretty significantly. But one of the key takeaways for me from this study is that the response almost always resulted in a higher cost. In the majority of cases, it resulted in a higher cost option. So again, another paradox in terms of, how do we handle these shortage and supply issues, and how do we make sure patients have access to the care that we need? And there's no doubt that we are working better together today on these issues than ever before. And I would say hospitals, physician offices, suppliers like ourselves, as well as manufacturers, are collaborating more than ever. So maybe it's not in your headline each and every day. It's been replaced by a few other headlines now and then, but I would tell you that this issue might actually be more critical than it was before. We're getting used to it, which is a sad commentary. We're getting used to these adaptations. We're getting used to spending a significant amount of time, even hiring people focused on managing through these supply issues. And any large cancer hospital will tell you that this is actually a core part of people's roles and jobs. So we're absorbing the cost, we're dealing with it better, but we have a lot that we can do to do a better job in this area specifically. So what's causing this? What's creating drug shortages? I would tell you that, this chart is not exhaustive. It's just some of the key buckets, that we certainly see overall. But when you look at all of the factors, it's a multifaceted problem that's going to need multifaceted solutions. And nothing about this is easy. And when you look at really this life cycle that we're in, we're actually poised for potential more urgency in this as we have more products that will be available in multi-source or generic forms, which is exciting when you think about our last presentation and reducing costs, but actually might become just more frustrating from a patient access perspective. Let me tee up a couple of thoughts related to these factors. In terms of manufacturing quality challenges, this is an issue that's not just for the manufacturer. This is a regulatory issue and a partnership with industry as a whole that we, as kind of a neutral body that sits in the middle, get to be an observer of and have to try and address, but we don't get to fix or control. And I would tell you that the C in CGMP means current. And one of the challenges with that means that it continues to change and evolve. And so many of the shortages we see are not because there's a quality issue related to the product itself, but that the standard is evolving and actually doesn't lock in over time. So this is an area you could say, how can we partner together from a regulatory perspective to have, CMGP not be a moving target where it can create supply issues. So when we look at our supply issues, sometimes it really relates to a collaboration gap between the regulatory environment and those manufacturers that really need to resolve a compliance issue. And it gets compounded by the fact that there's really not a prioritization associated with that. So, the analogy for me, just kind of keeping the language simple, is that these issues fall in the stack, and you've got to wait till you get to the top of the pile. There's no one or no way really right now to pull out an issue that's an urgent supply issue, a supply issue that's impacting patient access, an issue that's impacting treatment decisions. There's no way to pull that one out and put it to the top of the stack. And that might be one of the creative ways we can work together to address this. Manufacturing complexity and cost is another significant issue. The costs are clearly growing because the good news is we're doing a better job improving that process, which often requires more components to it. But injectable generics, which really are where much of our crisis is related to supply, are more complex to manufacture. They require more investment by the manufacturer, and it's not an area that really there's currently an incentive to invest in. So it is very common to see only one or two manufacturers for life-saving products. No one else is attracted into that space. It's not attractive from an investment perspective, and that issue is actually growing more challenging, which is a significant issue. It's ironic for me. This morning I did run to Starbucks and grab my Starbucks, and as I had it in my hand and my bottle of water, I realized that many of the life-saving therapies that we have supply issues are actually cheaper than Starbucks and the bottle of water that I had in my hand. It's great news from a supply perspective, horrible news in terms of getting investment. So we have the really high cost piece that you see when a product launches, and then this dramatic reduction such that people exit the space from a manufacturing perspective. And that's what concerns me. I might have 5 to 10 suppliers that should be producing a product, but yet only 1 or 2 is currently producing the product. They have opted not to continue to produce that product. So we've got this, again, paradox that Barry teed up for the morning that is a real challenge in this area. And then we have limited market capacity, and I would add to this one, limited tools to do anything about it. So speed of ANDA approvals or speed of ANDA approvals is really an issue. Speed of inspections, when there is a challenge, again, can we pull things to the front of that pile to prioritize this area? There's areas I would like to invest right now to supply more products. We've got a current challenge, but I can tell you at best, it will take me at least 30 months to be able to get through just the normal requirements of the best case scenario to bring that product to access. That's a challenge, right? There's no way to, again, prioritize products with supply issues, and in cancer care, that's obviously a challenge, and that's then what leads us to having to perhaps opt for a more expensive alternative that would be available. And I don't see any immediate answer to this. We do have some maturing product portfolios. So while we have some new products that will be coming, we're in a gap where the current products available are maturing, which means it doesn't free up new resources from my view that I see manufacturers coming into this space. And then lastly, it's all built together with some of the issues that Dr. Gould teed up very well this morning, and that's the reimbursement constraints. And I think the way to think about reimbursement is that it really limits some of the normal laws of supply and demand. It really limits normal increases in prices, frankly. So on these very low-cost generic products, the ones that are cheaper than my Starbucks and my bottle of water, I've been asked on Capitol Hill many times, why doesn't the manufacturer just increase the price? Why doesn't that happen? Well, actually, they really can't. Right? First of all, there's multiple suppliers, so it's not like we can get them all together in a room and tell them to increase their price. That's one issue, but that's just one of many, right? There's actually sensitivity to that price. So the provider will be actually underwater or losing money from a reimbursement perspective when they increase that price. And the band of reimbursement, because it's fixed in terms of those margins at being very low, it's pennies. on a very low-cost product. So it's even more sensitive. These reimbursement constraints are actually more sensitive on your lowest cost products. So we actually have a disincentive to use low-cost products. Again, another ironic paradox when you think about the issues that our panelists teed up so far this morning. So what do we do about this? Well, clearly the reimbursement issues do relate to some of the drug shortages. There's no other way that there wouldn't be an incentive to manufacture these low-cost products. What's broken here? Well, we clearly can do something about it. In fact, our Dr. Gould teed up a number of the pieces of legislation that have been proposed, some of them for many years, that would help, because we do see the crisis growing the lower the product cost is, so that includes your low-cost generics, and it's going to certainly include this next wave of products. We have seen some payers try and be creative in this area, but it's difficult because as payers see a price increase, it often takes a lag to actually adjust reimbursement, even if they're intentional about it. But particularly among private payers, generic products go down more than they go up, and so when that happens, they actually lower reimbursement even more quickly. So we don't have a way that you can make up on a basket of products with some going up and some going down. Typically, you'll actually see payers on the private side reduce reimbursement very quickly with any kind of price decrease. So again, not an intended consequence, but certainly something that's impacting this. So how do we shift this normal supply-demand issue from being abnormal to normal? How do we attract manufacturers to this market? Do we incent manufacturers related to shortage products? I certainly have heard a number of mandates being proposed, a number of new requirements related to manufacturers, and I worry about those mandates, to be honest with you. I don't think they will help. I actually think they will shift manufacturers out of this space. We actually need the opposite. We need more collaboration, more coordination. Think of it simply, I need the Office of Compliance and the Office of Drug Shortage to start working together, right? And then I think could actually really make a difference on some of these issues. And then hopefully we could also align those economic and regulatory environments as well, so we can expand access to low-cost products. One frightening trend that really is off the current headlines of this year is that when you look at the largest generic manufacturers, those that are focused on generics, there's 4 large ones in the United States. If you look at what they're doing, all of them are actually investing in brand versus generics. They're diversifying their portfolio. And that's a hint to me that we do have a problem that we need to address, because those are the same manufacturers best suited to be able to help supply us with low-cost options, particularly as this patent change begins to shift and as we look at biosimilars. So how do we really support patient access? Well, we are working together on the backside of this. Now, that's kind of like making lemonade, right? That's not solving the problem, but we are working better on the backside to prevent these supply issues, to coordinate together, to manage patient access. We are really have taken steps to prevent hoarding and behaviors that really can compound product supply issues. That's critical, particularly on low-cost products in particular. We manage something we call a fair share allocation system that really seems to help mitigate the impact of supply issues. It frustrates our customers to no end, but it's really designed to put normal thresholds so that none of our customers can buy more than their normal amount without some type of intervention. We would need a rationale. We need to understand, why they would be purchasing more than their normal piece. Again, that's me now taking time with a healthcare practice, whether it's a hospital or physician office, me now intervening and using some of that practice's time. So it's not an inexpensive proposition, but that's what we're doing today to make lemonade related to drug shortages. I know we can do better than make lemonade. What else can we do? Well, I thought I would tee up a couple things to close to be able to have some discussion when we get to the panel. We certainly can think about some of these. Could we accelerate or prioritize the regulatory support, particularly for those low-cost products or any product with a supply issue? Would that help to expand the capacity that we have today in the United States? And we have seen some creative solutions by a few private payers on this issue. There are a few private payers that have actually changed their reimbursement multiple to be higher on generic or low-cost products. So they've actually increased or incented reimbursement associated with those products. similar, but perhaps a little more aggressively, frankly, than what has been proposed we would do with biosimilars in order to incent the use of biosimilars. But as was teed up by an earlier speaker, in the area of cancer, we really need Medicare to lead. Medicare is more than 50% of the dollars here, and while I salute these efforts by private payers for any healthcare provider, hospital, doctor, et cetera, it really won't make a lick of difference if we don't have Medicare involved in this as well. And then we need really all payers, to really help us do a better job of making sure reimbursement is sensitive to price changes in an appropriate amount of time. So when prices go up, have that reimbursement follow, and when prices go down, have that follow, but have that timing be the same. And obviously that allows us to take closer to the cost of the product, so we can have some of the normal laws of supply and demand in this environment. The regulatory and economic environment, I think when you think about it, really seems to be the cause, of some of the challenges that we're having related to supply. Again, I'd like to focus on collaboration. I think that's the positive message related to drug shortage. I think there's an opportunity for us together to take action in these areas to really address these drug shortage issues. A number of the bills that Dr. Gould mentioned also will help on that economic side, which is critical, because you can see the drug shortage issue really is a symptom of a number of the other things we're talking about. This is a symptom of other issues, but it directly impacts patient access and treatment. Thank you.
Thank you, Peyton. So our presentations draw to a zenith with Mark Hartstein of CMS, who'll talk about CMS reimbursement policy.